And so, hi, my name is Katie Abbott. I am with the Scripps Gerontology Center at Miami University, and I am joined with some fabulous colleagues that I'm going to introduce in a minute. But what we thought we'd do is do a quick little kind of brainstorm or word cloud. And I'm going to switch screens. What I'd like you to do is the question that we'd like you to answer is, what is your biggest frustration when it comes to working with residents or clients' loved ones? To answer this, I'd like you to go to www.menti.com. It's going to prompt you for a code. I'd like you to enter the code that you see on the screen, and you should have a box that you can type in and submit a response. And so I'm going to switch. Thanks, Alex. Alex just dropped this into the chat box. And I'm just going to switch my screen so that you can see the Menti screen. And so just give me a minute to swap my view. But feel free to follow the. All right, can you see the Mentimeter? Alex, give me a thumbs up. Are you seeing the right screen? Great, thank you. Awesome. Oh, what they want is different than what the resident wants. Oh my gosh, absolutely. That somebody has a goal that their loved one was, up every morning by 7, and they want they want that loved one up every morning at 7. We've even heard a story where a resident came in as a vegetarian, and the family said she's a vegetarian, feed her only vegetarian foods. And one morning, and she wouldn't eat. She basically stopped eating. And one morning, she seemed interested in bacon, and they gave her some bacon, and she ate it. And the family really had concerns about that. And the community was like, look, this is what she's wanting to eat, right? Ooh, another good one. They want to be involved, but the resident doesn't want them involved in care discussions. Challenging situation. And boy, do we have the right people on the call today to help talk these through. So let's give another minute just for you to put in any responses you might have to this question in terms of what's your biggest frustration? What about if there's multiple family members, right? How do you then sort of bring all of these differing viewpoints together? And so go ahead, and if there's any last folks that want to sign up or to go ahead and answer, please do. I'm just going to stop sharing for a moment, and then I'm going to go back to our PowerPoint slides, and I'd like to introduce our esteemed guests. So I am so fortunate that I am able to work with amazing people who actually have done this work in practice. And so I'm joined today with Crumbie and Sarah Humes. And I'd like them to tell you a little bit more about themselves, but I'll tell you just briefly what I know about them both is that they've both been working for more than a decade in communities such as nursing homes, consulting with assisted living, adult day, home care. They have a breadth of experience, primarily as activity directors. And so they've been managing staff, activity professional staff, and also in administration as nursing home administrators. And so they just have a wealth of information. And they were also in a community that focused on preferences for individuals and how to assess those preferences, honor those preferences, and then check the quality improvement around how well are they meeting those preferences. And so again, my name is Katie Abbott, and I'm also joined with Alex Hepner, who is our just goddess of all things, who just, she makes the whole ship run. And so she's going to be behind the scenes helping out and dropping some links in the chat. And so anytime that you have a question, don't wait, just drop it in the chat. Or we have a Q&A feature. You can put it in either place. We will see it. And we'll also have time at the end for questions. So where are we coming from? Our group, our team around preference-based living is coming from the primary notion that, and Alex, are we recording? I forgot to ask if we were recording. This might be a good time to sound good. Thank you.
Yes, we were recording. I remember I started it too soon and then I paused it, but I remember to start it again. So we are good. You can keep going.
Oh my gosh. Woo boy. So our premise is that one major aspect of person-directed care or person-centered care are that individual's preferences. Do we know their preferences? Can we honor those preferences in the care delivery process? And then can we assess how well we're doing in meeting those preferences? And so person-centered care, from our perspective, seeks to understand each individual's preferences, goals, and values, and to honor them throughout that care delivery process. This is only one way of providing person-centered care. We by no means are trying to say this is the only way. We are just saying this one slice is where we have a lot of experience, depth, and credibility in doing this work for over 20 years. And what we know, and what you all know, is that when preferences are understood and honored, people have a greater sense of autonomy, improved quality of life, and emotional well-being. And that's what everybody wants at the end of the day, right? Okay, and so I want to turn it over to Tori first to start talking to us about, what are the benefits of integrating family and friends into the care process. So Tori, take it away. And you're muted, by the way. Because we've never done a webinar before, right?
All right, can you hear me now? Perfect. All right, so now we'll jump on in and let's talk about the benefits of engaging family and friends in our care discussions, because let's be honest, more often than not, residents will come into long-term and have family and friends that are a part of their support system. They're kind of this unspoken package deal that we get when they move in. Sometimes we wish that pesky admissions team would warn us a little bit about what we're getting ourselves into, but regardless of the situation, there are definitely benefits for embracing and involving those family and friends in care discussions. So again, more often than not, every resident will have a family or close friend supporting them. They might be involved very frequently. Some people are, daily involvement. Others might be involved less frequently. Some people live close, far away. Each scenario will have their own unique dynamic and relationship that you'll have to figure out as healthcare workers. But it is important that you tune into those relationships and that you use them as part of your care planning process to strengthen your person-centered care. I also think it's very important, as we discuss engaging family and friends, to think about some of these family and close friends will come in and they will have been the previous caregiver for our new residents. And it's important to recognize that the caregiving role doesn't stop when residents are admitted to long-term care. The relationship is still there. Their roles and their responsibilities might change. And I think it's important that healthcare workers can help have more discussions about that, so that these family members and close friends know how to adapt and adjust their role as the resident and they adjust to life in long-term care. So definitely something to keep in mind as we are engaging them. They have very close relationships. They might have been someone's sole support. So there might be a lot of changes that you want to navigate very sensitively and compassionately. All right. So family and friends are we can just go back. I'm not done just yet, Katie. So these family and friends are very essential advocates for residents. As mentioned, they can really help smooth the transition into long-term care. They can help us gain insights into residents' preferences, their routines, so that we can help them adjust to their new environment. And that's really one of the biggest benefits of having them engaged in care discussions as they move in, but also throughout their length of stay through the continuum. So now we can go ahead to the next slide. All right, so if we don't have you convinced that involving family and close friends in care discussions is beneficial because it's the right thing to do and it helps further our person-centered care. For those of you in the nursing home environment, there are compliance benefits to this. So there are regulations through our federal, CMS regulations that state residents do have the right to be involved in their care planning process. And those regulations extend to say that residents have the right to also involve the family and friends that they choose in care planning. So making sure that family and close friends are involved in care discussions and specifically the care planning process can support your regulatory compliance. And then another compliance related benefit that may have fallen by the wayside, because I know that the COVID pandemic has kind of shifted our focus from a lot of things, but part of the phase 3 regulations for nursing homes that was going into effect is trauma-informed care. This is a new regulation. So while many of us the last year have been hyper-focused on the pandemic, infection control, which is absolutely where our focus should have been, I think it's about time that now we get back to thinking about all of these other regulations, all of these other compliance areas, because although surveys took a pause for a little bit, they're starting back up again. Surveyors are coming back out. And pre-pandemic, I know that resident-centered care planning was a big focus. And I anticipate that as surveyors get back out there, beyond looking at just infection control policies, they'll also really be looking into, are we compliant with resident-focused care planning and possibly even this new regulation about trauma-informed care. So if anyone's not informed with trauma-informed care, basically it recognizes that throughout any individual's life, they could have been affected by trauma in some way. And nursing homes are responsible for identifying that and being sensitive to that fact, making sure that our environments are safe and secure for our residents, and that we're doing anything we can to avoid possible trauma or re-traumatization. So where family and friends can really be essential in this is as residents identify people who they would like in their care discussions, that can help us key into their support systems. So if there is trauma or potential for trauma, we know who they want to be involved in care discussions. We know who they look to for support. Additionally, it may also help communities identify possible relationship strains amongst residents and family members. So you never want to assume that because a resident has a child per se, that that person should be involved in care discussions. You absolutely want to give the resident the choice and the right to decide who they want to be involved. For example, I had a resident in my community who specifically did not want their daughter involved in care discussions. We respected that right. After learning more about her, there was some deeper trauma, which is why she did not want her involved. And it was very important that staff was aware so that they knew what kind of information to share with the daughter and how to share it. So definitely something to keep in mind as you're looking into how to best engage family and friends. All right, let's move on forward. So we've got our compliance. There's also a lot of benefits to engaging family and friends for our residents with dementia. So Sarah, I'm wondering if you would like to speak a little bit to this, one of our favorite populations to work with.
It is one of my favorite populations to work with. I think it can be very, very tricky to work with family members for a lot of reasons when their loved one has dementia. First, it's just a very confusing disease, especially when their family member is going in and out of moments where they are lucid. I think it's really hard for families to understand, why could they express themselves this day and not that day, and on one topic at one point, and at another point in time, that topic is completely lost to them. So I think one of the best ways that we can help support that entire scenario is by learning our residents as best we can, because we can see them through a less emotional lens. And then we can work to advocate for the times that they are more lucid and what we are seeing with their response. So for me, one of the key things that I always shared that I think was helpful for any of my employees or family members, other staff in the facilities that I worked in, was that you can learn a lot by observing the emotion that you see from someone with dementia. So they may be telling you something verbally that is completely opposite of what they are showing you with their facial expressions, with their emotions, with their actions. And trying to look at both of those things. What are they saying to me verbally? What are they showing me emotionally? And putting that together to try to get the information that you need from them. And then helping families to understand that that's what you're using as your tool to help continue to advocate for them. And, you know, within that, I think it's really important to honor when you have those positive interactions, and they may be few and far between, but they're super significantly meaningful, because that is when you're getting true information. And that it's okay for it to be few and far between, and to, you know, focus on those good, positive moments that you have. So I think generally speaking, that's kind of my biggest piece of advice.
Absolutely. I'd also just like to note that for those of you with maybe a new resident to your community with a diagnosis of dementia, as you're getting to know them, remember that individuals living with dementia can still self-report their preferences. Tools such as the Preferences for Everyday Living, Peli for short, one of our favorites, has seemed to be reliable with this population. So, you know, despite the diagnosis, of course, always try to get the residents' input first. It's a, you know, you want to try that, but depending on where someone is in the stage of dementia, you may or may not have that opportunity to gain those insights firsthand. So definitely looking towards family or close friends may be a, you know, vital support in learning about their preference information, especially if you're not able to get it from the residents when they join your community. All right, and then of course, we have to acknowledge how engaging family and friends can really help strengthen these pandemic era relationships. Again, COVID has changed everything for healthcare, for everyone, no matter what. So, you know, engaging family and friends, there are different ways that it can help strengthen relationships. One way would be to strengthen resident and their relationships with their family and close friends. Visitor restrictions has been an enormous strain on that. They have limited contact, limited visitation. So making sure that we're supporting those relationships is key in this time. Also, as residents are experiencing possible withdrawal or apathy because of communities focusing on mitigation strategies, which include limited communal dining or limited activities, we can really tap into family and friends to help us figure out what are ways that we can help make our residents' environment more comfortable, more engaging. How can we help them connect and feel more secure, you know, while we're still navigating this pandemic? You know, we'll see where it goes next, basically. And the other way that engaging family and friends can help strengthen relationships, especially at this time, is to reconnect healthcare workers with family and friends, help strengthen that bond. Again, they haven't been allowed in some communities, contact has been limited. So just taking the effort to involve them in care discussions is really one way of showing family members and close friends that we want you involved, we want to have a relationship, we want to know what, you know, interests the resident, and your input is very important. So reaching out and making sure that they still have that relationship is definitely something that's very important at this time. All right, so let's get into some tips now that we know it's important about how we are going to involve our family members and our close friends in care discussions. And the goal of all of this is to build positive relationships and communication. So number one, we'll start from the top. As someone joins a new community, you simply want to start by asking them how important it is to have family or close friends involved in discussions about their care. So for those of you in the nursing home setting, this will be a part of your admission assessment. It's in section F of the MDS. For those of you in other settings, assisted living, adult day, home care, anywhere else, If you're not already asking this question, I would encourage you to go ahead and add this to your admission assessment. If this is something that the resident states is important to them, go ahead and follow up by asking, who are the members you would like involved? What would you like them involved in? How? Try and get that contact information so you can follow up in the future. All right, next we have tip number 2. You're going to go ahead and add the names of individuals whom the resident wants involved to their chart. So I'm going to encourage everyone to go ahead and follow their community policy. Communities will have different policy and procedures of where they would like this information documented. But go ahead, follow your community policy, whether it's adding this information to the face sheet, the care plan, in your electronic health record. You'll want it noted so that we can respect the resident's privacy and make sure that we're sharing information with the right people at the right time. And then once you know who the resident would like involved, you have their contact information, you're going to go ahead and schedule a care conference for the resident and make sure that you invite that family or friend. This can be done through, most communities will have a standard procedure, an invitation by mail. It could be email, over the phone, could be as informal as in-person invitation, but go ahead and make sure that we're making the effort to make sure that the individuals they want involved are in fact invited. And then if for any reason someone's unable to attend in person, whether it's because of their work schedule, distance, again, COVID restrictions, you will want to make sure you have different accommodations to include them, whether it's through phone, or if anything, COVID has taught us there's plenty of virtual options. So get the Zoom, WebEx out, anything that you have at your disposal to make sure that they can still be involved if it's not in person is a great benefit to the care conference. And then once we have these family and friends in our care conferences, as the facilitator, make sure that you're allowing time to encourage your family and friends and residents to ask questions and express their thoughts. All right, we can go ahead to the next slide. Tip number 4, we want to keep the lines of communication open. And again, this is going to help us build trusting relationships with the resident support system. So oftentimes in day-to-day hustle of everything we need to get done, communication waits until the care conference or until an incident has happened. I can't tell you how many family members I've called for, to say I want to take your resident out on a trip, and they answer the phone thinking I'm calling because of a fall or something bad has happened, because they see the number pop up from the nursing home and they think this has got to be an incident, something bad has happened. Please try if you can. Again, this is best practice. I understand we're all busy, but if you can take, an extra 5 minutes to reach out proactively, or it's something positive, it makes a huge impact for families and that relationship building. So aside from care conferences, some good times to reach out that we would recommend would be if there's a new or a changed order that's happening, if the resident has an appointment, I'm sure family and friends would love to know about that. Other instances might be if you're noticing a change in status, maybe it's not something drastic yet, but you're noticing something, you could reach out. Anything proactive is definitely better than reactive. I'm sure we all know that. And then again, if you can go that extra mile, even beyond just letting people know when something is medically happening, reaching out to let them know that they're making gains in therapy or that they're participating in community events, those go such a long way. So if you can snap a picture or just send a quick email that so-and-so had a great day, they completed their craft project, I was taking pictures of our residents getting their vaccines during our COVID vaccines and sending those out. Families loved it. So those little surprises really go a long way to provide reassurance that, we're providing great care. And then tip number 5 is, of course, a reminder that guidance from family or close friends and care discussions is not a replacement for the resident's voice. So it's important to get their input. It's very valuable, but it's supposed to be a complement to the care planning process, not a replacement for the resident's voice, preferences, and wishes. All right, we can keep on moving along. And then, of course, number 6, Another tip to engage family and friends: if you do want to gain more insight for the care plan, just getting to know more about the resident, you can consider asking additional questions from the preferences for everyday living. So the Peli interview, there's a lot of really great scripted prompts and follow-up questions. So I'll let Katie give you a little overview of that.
Thanks, Tori. This is just such great information. Thank you both for being here. So the Peli, if you're not familiar, I'll spend 30 seconds telling you about it. And then at the end, we'll give you our contact information so you can reach out to us if you have questions and would like more information. This is a questionnaire that has been developed for now, it's probably been in the field for close to a dozen or more years. And the idea behind it is that we're trying to understand what are the important preferences people have. And we started off by doing interviewing 550 individuals receiving home care. And then we received additional funding to take it to the nursing home setting. And we asked over 350 nursing home residents about these questions. And we did a lot of cognitive interviewing with them to make sure that the questions got to the content that we were looking for. So for example, if we asked, how important is it for you to take care of your mouth? We know that they're thinking mouth, teeth, and gums, like brushing your teeth, and not like, oh yeah, it's very important to watch what you say around here, right? So we tried to make sure that that was all scientifically validated. 16 of the items in the Peli are consistent with the MDS Section F. If you're in a nursing home, you're familiar with that section. And information from the Peli can be incorporated into care and quality improvement efforts. Because of the way we ask the question, how important is it to you? Then we can wrap some quality improvement around it. And I'll show you some examples. And here's an example. You can ask, how important is it to you to have regular contact with friends? And you can get it very somewhat important, but maybe can't do, or not important. If it's not important, you go to the next question. If it is important, you get a little more detail. The number one important preference that we have heard from all of our studies is this one. How important is it to you have regular contact with family? This is the most important preference that residents and clients have. And so again, understanding if it's important, and then if it is, whom shall we try and help you maintain contact with? So again, these items are each item is a standalone item. You can pick and choose which items from the Peli that you want to incorporate into your work, and we would be happy to do a consultation at no charge to talk to you about that effort. Okay, so now I'm going to turn it back. I'm not sure if it's going to Tori or Sarah to start moving towards talking about effective care conferences.
All right, so when it comes to effective care conferences, we did have some more tips that we wanted to share with you, because I'm sure if engaging family and friends in these conversations was a cakewalk, you might not be tuning in today. So what we are going to focus on is providing you some language that will help you redirect while still validating concerns, which is very important. I think oftentimes people might get tripped up in these care conferences. You're worried about the time, covering all your topics, what to say, and when things start going left, you might not know exactly how to get things back on track. So we're going to give you some language that helps you redirect. Again, language to help you get the conversation back on track that still lets family and close friends know that we value their input. We want them to know that for sure, but we also want to make sure everyone in the room knows that the focus should be on the residents' preferences. So we want to help you get that point across in the easiest way possible. We're also going to give you some language to help you reflect on residents' emotional well-being. I think this is another tricky topic sometimes, and this is from the healthcare worker perspective. If there's something you're noticing and maybe you want to bring it up, maybe a resident has emotional or behavioral distress, and you want to make the family or close friend aware of it without kind of like raising red flags or making them upset, we want to give you some language to bring that up, but keep the conversation focused on preferences and positive approaches, so we don't get derailed, trying to, we're going to keep things on track. And then finally, we're going to use strength-based language throughout this. We want to make sure that we're focusing on what makes our residents feel good, again, rather than going down that negative path of always thinking about what makes them upset. Hopefully that makes the conversations a little bit easier for everyone in the room. All right, so let's go on to our first redirection. So let's see. We're going to redirect the care conference and related conversations to the residents' preferences using positive language. I'm sure this is something that none of you tuning in have ever experienced ever, but for the family member or friend who repeats a concern over and over again, at one point in your conversation, you might need to stop them and try to get things back on track. So the redirection that we would recommend here is very simply, you've mentioned your concern a few times now. We'd like to understand what's the important preference of the resident. Again, just very simple, clear cut, kind of stops the direction and brings us back to that preference focus. I can't tell you, I mean, there's one gentleman that comes to mind for me, and it was every single time he talked to anyone in our building, he was constantly complaining that his father did not have his hearing aids in. And he would stop everybody every time, over and over, no matter what. Dad never has his hearing aids in, why not? And from my position at this time as assistant administrator, I heard his concern. I became very worried. You know, I'm talking to his care team. Why doesn't he have his hearing aids in? Is there a problem? You know, are they missing? Turns out in the end, the resident didn't like putting his hearing aids in. Every time the care team put the hearing aids in, he took them out. Maybe he found them uncomfortable. Maybe they weren't benefiting him, but anytime his son had a chance, he was constantly asking about the hearing aids. So this is language that you could use in this instance to kind of stop the care conference, bring things back to preferences. So when you ask if this is important preference to the resident, of course, if the family member tells you, yes, this is important, the team should acknowledge that, tell them, thank you for letting us know. Understanding its preference will help us make sure that we do provide the best care for the resident. Make sure you're adding it to the care plan. Ask if there's any other important preferences you should know. If that preference is already a part of the care plan, like it was in this instance, but it's kind of an ongoing issue that's coming up, just let the family member know. We appreciate you reminding of this preference. We'll try our best. We'll do better. And then sometimes there's the instance where the family member brings up the concern over and over again. But it turns out, as you know, the instance I shared, the preference is not very important to the resident. This resident didn't really care to have his hearing aids in, although it was very important for the son that he did. So in this instance, we recommend some language such as, we can try and see how the resident responds to that, such as, you know, putting his hearing aids in. However, we'd like to focus on what they would prefer. And we want to make sure that we design a plan of care around their most important likes and dislikes. So what this does is it pauses the conversation and just reinforces that while we hear you, what you're saying, that's a good suggestion, we do need to make sure that we're upholding the resident's preference at this time. All right, let's jump to the next talking point. Here we're going to focus on getting our conversation back on track. And this is for our resident or our family member who tends to run through a laundry list of concerns. Again, I'm sure none of you have experienced this. Never happens, right? So I'm picturing right now the person that sits down in the care conference, and when you ask them if they have anything to share, they start with their laundry list of, you know, what medication dosage is this person on? What's their weight? When's their next dentist appointment? Their nails aren't trimmed. She's telling us she's bored. Her clothes need to be laundered. That reminds me, her shawl is missing. When can we get her back on PT? She really needs to be in PT. And by the time they're done the laundry list, nobody in the room knows where to start because they've just thrown everything out there. So what do you do in this instance? There's so many things to cover. What we recommend is, again, just very blanket statement here, but let the resident's family member or close friend know that they've brought up lots of great questions and concerns. Remind them they only have a short amount of time together, and the team wants to be sure we focus on the preferences for the resident's care plan. So I encourage you to let them know that follow-up can happen after the meeting. So we have here, we can have each department follow up with you after this meeting to make sure that all of those different points are addressed. Because again, in this instance, and this usually happens, they usually have one point for every discipline in the room. And let them know that during the remaining time, you know, ask them, why don't we discuss what's most important to the resident? All right, jumping onto our next tip to get the conversations back on track. What happens when a family member or a friend shares conflicting preferences. All right, so just going back to my experience from recreation, one of the top things I would hear from family or a close friend is that so-and-so needs to be involved in activities all day long, no matter what. If they say no, doesn't matter, they need to be involved. And while I appreciate where they're coming from, because activities are so beneficial, and of course they should be involved in my activities, because that's what I'm here to do, I totally agree. Sometimes you need to, again, refocus the conversation on what the resident's preference is. So here are, suggested language for you would be, you've mentioned that you believe X should be done. That's a good idea. However, in the past, this resident has expressed Y is their preference. So again, while we value your input, the care team needs to focus and honor on the resident's preference. So in this instance, I would let people know that I agree, activities are very beneficial, and I think that's a great idea if they were to join in more. However, this resident has expressed in the past that their preference is to spend time alone. So we need to continue to honor that and allow them to spend their time alone. We'll certainly encourage them to join when they're feeling up to it, but that is their preference that we'll uphold.
Yeah, and I think if I can jump in for a second there, Tori, that especially that example that you're saying of a preference to be alone, I think ends up being more common than people hope for their family member. Or they look at it as a really negative, maybe almost side effect of moving into a long-term care scenario, because I think people really associate it with, my family member needs to be around other people. And in fact, they still are, even if they want time alone while they're in the facility. But I think just really putting that emphasis on the fact that it's not you have one request and they have another, but that we are working very hard to listen to the most important request of your loved one. And at the moment, that is that they prefer to be alone. And we are not ignoring them from here on out because of that. We are going to continue to evaluate their preferences and their needs and make sure that they know we're putting their preferences first. And then the other thing I think to add into that too, just from the therapeutic perspective, I mean, I think you and I both always had experiences where maybe that was a preference, but there was also a more underlying need to be involved to a certain extent. And so that we then kind of can find some flexibility within those two requests of being around a lot of people and being alone, but also needing to be involved somehow. If that makes sense.
Absolutely, thank you. All right, so going ahead to our next tip, again, we're still focusing on getting the conversation back on track. What to do when a family member or a friend talks over the resident. And I've seen this in a few different scenarios in care conferences. Sometimes there's that moment where you're having a discussion, and if you really focus in and look at the resident, you can see that they almost gesture like they're going to start to say something, but they're cut off and they never do because their family member friend kind of brings their own perspective in. And then there's other times where you might notice that a resident doesn't even attempt to gesture or begin to share their thoughts or opinions. And it might just be because maybe they're not comfortable sharing with the team yet, or they feel like they have their advocate there with them to speak. So I would encourage everybody while they're facilitating their care conferences to always make that extra prompt to ask the resident to share their thoughts. So here, if a family member or friend is actually talking over the resident, let them know, again, we really appreciate you for joining us for the conversation. Your input's extremely valuable. And then shift your focus to the resident. Using their name, ask them, would you like to share your thoughts? Can you tell us what is most important to you? So that we're, again, stopping the conversation and putting the resident into the forefront there, bringing the focus over to them to share their personal perspective. All right, let's jump to the next slide, which I think I'm going to hand over to Sarah to cover.
Hi. Okay. Sorry about that. I had a minor child interruption for a moment because candy is the most important thing these days. Okay. So getting us back on track here. So when a family member or a friend's view of the preferences is too narrow, so this comment comes from, oh, well, they can't do any of that anymore. Or when you ask for preference information, the family members and friends are telling you that none of what was a preference really matters because it's not easily available, or they can't do it anymore, or all those kinds of things. And so that's kind of when we really want to help them understand that we are professionals in the matter of meeting preferences. And so all we need is a list of information. We just need to know what it was. It can be skydiving, and we will figure something out. That it is not up to the family to kind of focus on all of those things. And furthermore, there are a lot of personal care preferences and medical preferences. So we say, like, so far we've touched on your personal care preferences and medical needs, right? So the family member and friends have given this loved one to our services because they can't meet their needs anymore. And most of those needs are the personal care and medical needs. And so they are going to constantly try to make sure that those needs are being met, because that's how they can still keep that caregiver relationship going. But the recreational and social preferences of the resident are highly important to the success of the other things. So the person who doesn't want to wear their hearing aids anymore, but the family that wants them to, and it's that constant battle of which thing is important, really trying to get them to focus on the fact that there are other things that can be just as important, and it's okay to let go of certain things. As we planned this webinar, I shared a quote from my uncle who died very young of ALS, Lou Gehrig's disease. He was an artist, huge artist. He was an art teacher in middle schools. And so not only did he love to paint and do different kinds of art himself, but he taught for years. And when he was diagnosed, he had a certain amount of energy afforded to him in a day. And he said, because he was able to verbalize this, I would rather have someone brush my teeth for me and be able to paint in the rest of the day than give up my painting just to brush my own teeth. Some people would say the complete opposite. Heck no, I would never allow someone else to brush my teeth. That's too much of my dignity gone. And he was like, if I have to give that up and I can still paint, I am all in. So, and it was great that he was able to verbalize that, right? But we may be dealing with people who cannot fully verbalize that. And so we're trying to support that scenario and trying to let families know that they can let go of certain things and we can focus on other things.
I love that example. So good.
All right, is this you, Tori, or?
All right, I can start with some of this.
Okay.
So now we're going to just kind of switch gears a little bit and talk about reflecting on residents' emotional well-being. So what we're doing here is, again, providing maybe some tips for the caregivers or the healthcare workers in this scenario who want to bring something up without, raising red flags, and keeping the conversation positive and preference-based. So for the resident that maybe has been experiencing some emotional distress and the team has identified that, one way to bring this up in a care conference or care discussion would be to say that we've noticed that, resident has been a bit down lately. Do you know what has made them feel better in the past? Can you share types of experiences they seem to enjoy most, things that they tend to find soothing, and how they typically spend their day? So what I do want to address here is that identifying triggers of the emotional distress is very important, and family and friends can be a huge asset in this. However, if, again, knowing your dynamics. If you want to keep the conversation from kind of spiraling into rehashing past issues or taking up, more time, because sometimes you'll never get to the root cause of the emotional distress, what you can do here is focus on what we can do to improve it. Again, you want to identify triggers. That's a very proactive approach, but this is for an instance where maybe their time is limited and you just want to keep the conversation moving in a positive, preference-based direction. So this would be your wording. And again, here, because someone's feeling down, we're going to look at what doesn't make them upset, but what makes them feel better. How can we soothe them? What's their, what's their day, so that the care team knows how they can maybe mimic that to relieve some of this distress. And we can go to the next slide now. All right, so again, in this instance, we're going to talk a little bit about experiencing behavioral distress. So for this one, we're going to say, we've noticed that this resident has increasingly been doing X. Can you share what kinds of interactions and experiences they find calming, how they prefer to spend their day? Can you recommend ways you could try to help them feel happier and more comfortable? So this is a great approach when it comes to different behaviors. What comes to mind for me is always the example of people who might tend to wander. Oftentimes people find that wandering behavior is related to a past routine. This person used to catch the bus, or this person used to go look for their kids at some time of day. That's information that you're really only going to uncover if you ask family and close friends about their routine. What was their life like before coming into long-term care? So you definitely want to involve your family and friends. But again, these other prompts that focus on calm and comfort, that helps keep the conversation in a more positive light. So Sarah, feel free to jump in if you have other examples or.
Yeah, I mean, I think there are probably a ton. One of my favorite unique ones was a man who had a lot of distress in the middle of the night, which I think is really hard because the bandwidth of support is not, it's just physically not in the building. And so, but even knowing that even then you can ask for how preferences can relate to keeping people calm. In this scenario, it was my favorite because this man was an avid wine lover. And so just like wine magazines talking about wine, simple little stuff like that really helped him to settle. But I think that this kind of thing is something people don't really think of as a way to calm anyone. In connecting preferences is a really big way to be able to do that.
I had a feeling you might share that example. But again, what this does is it empowers the team to be able to bridge these difficult conversations about a potential new behavior that might seem alarming to a family member or close friends. And rather than the reaction being, well, we need to put them on a medication, or, well, why aren't you guys doing X, Y, and Z to solve this problem? We can have a conversation that talks about, we do want to know how to make them feel better. We want to know what would make them more comfortable, calm, how can we best set up their environment for them? All right, and then on to our next one, which is for the resident that might be exhibiting apathy. What you could say in this instance would be, lately, this resident has not been showing much interest in activities. Do you know what their favorite activity is, or what time of day they tend to feel best and most apt to engage? Can you share any other important preferences or interests that this resident has, so we could support to better engage their interest and involvement? So again, it's starting the conversation, and rather than going in the direction of, well, why aren't they participating in X, Y, and Z? Are you inviting them? Rather than going down that road, we're going to focus on what would they like to do. Maybe it's that there's a time of day they feel best, and we need to honor that and make sure activities are offered then. What this does, it just sets up the conversation so that the family member or the close friend can be part of the solution rather than, the problem. All right, and again, through all of these tips, we encourage you to try to stick to using strength-based language, focusing on what makes the resident feel good instead of upset. Again, I want to stress here that it is absolutely important to have conversations about what does trigger residents to feel upset, and family and friends they can offer great insight into that. We just want to make sure that the language we're using keeps things moving in a positive direction that focuses on person-centered care and preference-based.
Wonderful. Thank you both so much. Just fantastic information. So at this point, please feel free to enter any questions you have into the chat box or into the Q&A box. We will see them in either place. And so I want to take, as you're doing that, I want to go through just a couple of additional resources here. So we have a lot of resources on our website, but we know that sometimes it's difficult to find the things you're looking for. And so for the information we're talking about today, we have this particular link that Alex is going to drop into the chat box for you that takes you to all of the links that we have identified here. We have a brochure, a little trifold brochure that you can drop put your logo on and put it in any move-in packets or any information for family that talks about why preferences matter and talk about why we're going to be asking you about your loved one's preferences. So sometimes that can be very helpful in setting up the expectations for those family members. We also have tip sheets on working with proxies. And so how, like Sarah and Tori were both mentioning, how can you engage other people who might have information about this loved one if that person isn't able to communicate their own preferences? We've got some training videos on engaging family and friends. We've got a webinar about guidelines, and we've got a facilitator guide around that. In addition, we have some care planning resources on the website. And again, all of these links can be found on the one link that Alex just dropped in the chat box. We have a tip sheet on how to integrate preferences into the care planning process. We have a training video on that, and our training videos are short. They're around 20 minutes so that you can watch them and put the content into practice immediately. And then we also have some other projects I'm going to tell you about. Everything, as I mentioned, can be found on our website at preferencebasedliving.com. And so what we thought we'd do for a moment, if we have time, is if you have a chance to go back to your mentee and talk and put in the box here, is there one approach that we discussed today that you'd like to try? And what I'm going to do is I'm going to switch and share my screen to the mentee screen so that we can see your responses as we go. And so hopefully you can see that. So again, go to menti.com and then use the code that's shown here to put some things. What did we talk about? Anything that really resonated with you that you'd like to try and put into practice? I know this takes a few minutes to populate. Maybe what I'll do is, as you guys are entering, keep entering. I'm going to go back to just wrapping up our slides, and then I'll come back to this one. And so a couple things that we just wanted to mention is that we're working on a new quality improvement project around the individualized positive psychosocial intervention. And this is where we specifically help work with you to provide meaningful engagement that's preference-based to residents with dementia. They are brief, no more than 10 minutes, activities that are matched to the individual's preferences and abilities. It's a one-to-one activity, and we provide you all the coaching, all the materials that you need at no cost because we have very generous grant support. And so if you'd like information about the IPI or to sign up, Alex will drop this link into the chat. We also have, Tori and Sarah mentioned, learning to recognize emotion. We have a fantastic course, online self-paced course that we just launched on the Miami University website, and you will get a professional certification in emotion-focused communication training. Again, at no charge, this course is being offered because we've had grant funding to develop it. You get a certificate of completion. You can put in your HR materials, put on your resume, and then please stay in touch. We've got lots of resources. We're on a lot of social media platforms. We have a newsletter. And so I want to stop there. We've got some comments in the Menti, and so I want to come back to that. And then again, just deeply appreciative to everybody for their time. So we see here that one person mentioned they wanted to use positive language to move the conversation forward and productively. I think that's really important. And Tori, you made it easy. And Sarah, you gave us suggestions. It was great. Using the suggestions for how to redirect conversations to focus on the resident. Again, great advice. Using suggestions to redirect, same thing. So same thing to really focus those conversations. So great suggestions. And again, we're just deeply appreciative to our presenters, to our speakers. If you have any questions, please reach out to us. My email, as well as Alex's email, are here. We will save this recording. We will close caption it, and we will get it up on our website shortly, probably in the next week. And again, just deeply grateful for your time and attention, and we'll hang out for a little bit to answer any questions. Otherwise, thank you all so much and have a great rest of your day.